It gives me great pleasure to be able to speak to you all today. I know that Sigma's annual pharmacy conference is a highlight in many of your calendars. I'd like to thank Bharat for offering me the opportunity to address you all. I'm sorry I can't be there in person. Today we celebrate community pharmacies and the work they've done to improve the health of the population. Community pharmacies play a pivotal role as a community and health asset and are often embedded in some of the most deprived and challenged communities, providing daily contact for people seeking health advice. Since taking up this job, it's become clear to me the passion that pharmacy professionals have for their role in optimising the use of medicines and providing advice and support to their local communities. I want to take this opportunity to look back at the achievements and challenges the sector has risen to over the last year. Pharmacies, for me, are an essential part of primary care, with over 1.2 million health-related visits every day. They offer inclusive, easily accessible health services, playing a key role in the prevention of ill health, the reduction of disease burden and support health and well-being across the board. The government is committed to ensuring that community pharmacy continues to play an important role in the health of our nation. The introduction of quality payments in the contractual framework in England has encouraged further integration with other NHS services and recognised community pharmacies that are keen to engage in the delivery of high-quality services. The high take-up, it really is to be commended. An example is the significant increase in the number of healthy living pharmacies found on our high streets. I'm delighted to say there are now over 9,000 HLPs, each capable of delivering a range of public health interventions, helping people to improve the health in their local communities. This is a fantastic achievement in a very, very short period of time. Whilst the NHS has faced increased pressure over the winter period, community pharmacy has once again stepped up to provide the public with the support that they need. This is especially true in regard to seasonal flu. Community pharmacy's response to this has been invaluable. Over 1 million people have been vaccinated in a community pharmacy since October last year. But not only that, they've supported many people through participating in the Stay Well This Winter campaign. Most recently, reacted quickly to ensure the ready supply of antiviral medicines. I've had the opportunity to get out and visit community pharmacies, as well as listening carefully to the representations made on your behalf by your professional and trade bodies. I've been keen to do what I can to support you, which is why I'm personally committed to seeing the long-awaited legislation be passed through Parliament to offer pharmacy professionals working in registered pharmacies a defence to sanctions where inadvertent preparation or dispensing errors occur. I'm also committed to ensuring that government consults on these defences being afforded to pharmacy professionals working outside of registered pharmacies, therefore guaranteeing parity across the pharmacy professionals. I look forward to seeing how the removal of the fear of prosecution translates into increased learning across the sector and improvements in what I know is already an incredibly professional service. There will be further work on medication safety, including the launch of a new initiative in the coming months, which will focus on reducing prescribing and medication errors across the health system. This programme will build on existing work to develop our understanding of how best to educate and inform patients about their medicines, as well as how we use technology such as electronic prescribing and medicine administration systems. It's no secret that the past year has been a challenging time for the NHS and community pharmacies. Finances are tight. We need to make sure we get the best health benefit from every pound of taxpayers' money we spend. That said, I recognise there have been some exceptional circumstances affecting community pharmacy this year, including the recovery of medicine margin over delivery from August at a similar time when some generic medicines increased in price. I've been listening to these concerns and therefore I have increased the advance payment twice to mitigate cash flow issues. I also recognise that November's unprecedented delay in announcing concessionary prices caused a bit of uncertainty for pharmacy contractors. However, it was important to understand the position of the market. I want to thank you for maintaining medicine supply to patients during this uncertainty. I will continue, I promise you, to listen, working with you and building on NHS England's excellent pilot work, looking at how best to embed community pharmacies and pharmacists into the wider health service, to deliver a service that really is fit for the future. We will face many challenges in the future, not least our ageing population, but I believe it will be an exciting one in which technology and new types of medicines and therapy will support us in treating illnesses and keeping people healthy for longer in the community. The skills of the community pharmacy team will remain key in helping people to get the most benefit out of both existing and new medicines. I wish you all an enjoyable and productive conference and look forward to continuing to work closely with all of you.